family of addicts. So I would start with the problems of the children who are living with the people affected by alcoholism and other addictions. So I have put in the first slide, shine a light around the world on hidden hurts, because last week you might have heard with Dr. Bandari about setting up a de-addiction clinic, and you all been working in the area of de-addiction. Majority of times, our focus will be on the addict. Even there are de-addiction centers who will admit the patient who will come for de-addiction, maybe say 3 weeks or 6 weeks or 6 months, depending on their protocols. But what happens is, majority of the times, we ignore involving the family in the treatment. So result of that, many times we will not be treating the addict completely. He comes with repeated relapses. So when we consider recovery, so recovery doesn't mean the only recovery of the patient or staying abstinent from the drug. So recovery is when he becomes functional in personal life, in occupational life, and in his social life. So the complete recovery of addiction is nothing but recovery of the whole family. So that is the concept. So all of you who are working with de-addiction should remember that a complete recovery is only when all the family members are better and relieved or getting recovering from the effects of addiction. Okay. So my thanks to TTK Foundation Chennai and my colleague Ms. Vidyashree, our psychosocial consultant at our hospital, and National Association for Children of Addiction, because I'll be sharing the details from them. Can you see this slide of alcohol use in India?
Yes, sir. Yes, sir. It is visible.
Yeah, you can see. So we may not find the difficulty so much actually, but overall, if we see the statistics, there is 16 crore users, because the first use of alcohol is dropped down as low as 13 years, and first use of tobacco in India is dropped down to as low as 12.6 years. That means more and more every year the people are using. So when they use, good number of them, 20% of them will become dependents. So 5.7 crore people are problematic drinkers and 2.9 crore people are dependent users. Like every day they need to use the drug, alcohol. So if you take only alcohol as a major problem, imagine 16 crore users and at least forget the 16 crores. We'll take these problematic users, 5.7 crores. Don't you think that the family members, if you just take 2 or 3 people, so we don't know that 5.7 crores into 3 are not happy every day because of alcohol. 2.9 crore dependents into 3 are having a very bad quality of life every day. So unless we involve the family in the treatment, so we are not doing enough. So we all know that addiction is a family disease. So unlike other ailments, many patients would get admitted under you for the treatment. Many times it's okay, even the patient stays in the hospital for 3 weeks, 10 weeks, or 6 months. That's enough. But here, it's not sufficient if only patient is away from addiction. So the other thing is, if the family is suffering because of the person's addiction, the worst affected are children, and last to recover are children. So we often use this term COA. COA means children of addiction. Earlier they used to use children of alcoholics. Now a better term to avoid the term alcoholic, we use children of addiction. Refers to those children who grow up in the families where one family member, maybe father, mother, or any close relative in the family is suffering, living with that addict. So their emotional, psychological, and social health is affected. So till recently, not much of work was done or to notice the problems of these people. So recent years, maybe 10, 15 years in abroad, they have started National Association for Children of Addiction at USA, UK, and a few other countries. They started observing the children of alcoholics addiction, children of addiction awareness week in February 2nd week every year to improve the understanding how children are affected and provide support to these children so that they have a less traumatic childhood and educate these children to help themselves. Also to educate the people to update knowledge to help these children. So the awareness week aims at helping the children to self-help themselves. Second thing is create a group of leaders. What we are doing today, the group of people who have joined this meeting will update their knowledge about the children who are suffering silently because of their parents' addiction, and they become the leaders in future. As you know, not all children are guaranteed with loving, caring family. In fact, there is no childhood for a child who lives with a parent, one of the parent or both of the parent, to be worst case, don't get any childhood if parent is alcoholic. Why? We will come to know why. So if there is addiction in the family, especially the alcoholism, though one person, either father or mother, is dependent, their routine is disturbed. Whole family's routine is based on the routine of the alcoholic. So usually the day will become very, 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 very uncertain. When this addict will behave abnormally, nobody knows. So the uncertainty rules the house. You know that you and me, anyone for that matter, we need some certainty in our routine. If there are a lot of uncertain changes in our routine, we become anxious, we become fearful. Like what happens next, we don't know. How will be tomorrow morning? I don't know. How will be today evening? I don't know. So there is inconsistency in the daily activities. So the children cannot attend their schools regularly. They cannot do their homeworks at home. They cannot prepare for exams because of this sudden, unexpected quarrels, fights in the houses. So family act differently inside and outside home. So inside the home, they are unhappy, they are screaming, they are fighting, and outside they present as if an ideal home or they're living very happily with each other and all. So here is a child who is confused whether his father or mother who is drinking, who drinks but refuses to accept it. He feels as if he has no problem with alcohol. And in the schools, teachers say that alcohol consumption causes problems. And my father says that, there is no problem. I drink just to reduce my pains and aches. So he is confused. This boy is confused. Or when they go out, most often mother or family members don't reveal about the family problems. There are problems, financial problems, or the fights, but nobody talks about it. So this child is confused, and the children and parents' role are confused. Many times, children are supposed to be children. They should enjoy their childhood. But what happens in an alcoholic family? The child start presuming the roles of a mother because the father is drinking. So mother is upset and sitting alone. So child thinks that he has to help the mother, and he takes up all the responsibility of the house. Even an addict also, like he will be taking care, giving bath to father, or even sometimes getting alcohol for him. If he was going for a work and that day the son replaces the father's work, when he doesn't go, absenteeism, he covers it up. So the parents' role and children's role are usually exchanged or confused. And most of the time in the family, all of them keep worrying about the person who is addicted. So the effects of parent substance use on children are multiple. So First thing is they develop very low self-esteem because the feelings of shame and guilt predominates. Any child of an alcoholic, if you see, they'll be suffering with shame and guilt and inadequacy. But it's none of their fault. It's none of their fault actually. The parent is addict, but what child has to do? But problem is the children believe that the cause for the parents' behavior is them. So such a very sad situation. The child believes that because of me, I'm not a good child, so my father is like this. So he will have a very low self-esteem, and which results into anxiety and depression. Always there are fights in the house, uncertainty in the house, instability in a unstable environment in the house. So they are prone to develop anxiety, depression, obsessive compulsive disorders. They repeatedly clean their hands, repeatedly rewrite, reread things. So they end up becoming more perfectionist because they will presume that me being more perfect or not doing any mistakes will solve my family problem. They take a magical solution for the family mess. So if I be more clean, I can remove the mess in the house. So they are prone to develop obsessive compulsive disorder, fear and confusion, because all the time, you see, if you interact with the alcoholic children, they will reveal their experiences. If there is a evening, other day we were listening to a child who was narrating about their childhood. Every day, if the auto comes nearby house, the sound of auto was so terrific to them, because if auto comes, somebody has brought their father in the auto. So even now, after 20, 30 years, she was saying that if auto comes and stands in front of the house, which is a normal thing for us. So for other children, if auto comes, some relative has come, some guest has come. But for these children, if auto comes and stands in front of the house, it creates a fear that, oh, my father has drunk and fallen down somewhere and somebody has brought him in auto. So such sort of fear and confusion all the time. And very sad thing, all of us has to know, if we are working in the field of de-addiction, our motto should be to reduce number of addicts also. But what research tells is the children of addicts, alcoholics, they are 3 times at increased risk of developing alcoholism in their future life. So they have genetic risk, they have accessibility in the house. Being a teenager, out of curiosity, there is all chances that you will learn from parents, and the drug is available in the house. So we have to create an alternative sources of pleasure. We have to create alternative ways of leisure time management, so that even if the child has genetic risk, he is prevented from getting addicted, because there is one responsible adult in his life to just deviate the turn, deviate the problems. So delinquency and acting out, the children may engage in disruptive antisocial behaviors, because all the time, somebody is scolding them, somebody is hitting them, somebody is bashing them. Nobody bothers there for emotional health. There is all possibility that they show it on somebody else. Hope my slides are changing over there. You are able to see the change in
Yes,
slides.
sir. Yes, sir. Yes, sir. Changing, sir.
Yes. Social isolation. So if I'm a normal child, I go to school, I want to make new friendships, I talk to teachers, and I rarely suffer from loneliness. But what happens to a child of an alcoholic? Because the child believes that, my parents are not having a good behavior, so I will not make friendship with anybody, because if I make friendship with another people, another friend, he will come to know about my parents, so it will be a shame thing. If I engage with friends, I have to call them home, so better is not to make any friendship. So they themselves isolate themselves from friends and teachers, so they don't mingle. Academic troubles, automatically there is no study environment in the house. So even when they are in school, many children of alcoholics, when we are talking to them, either they don't go to school, school refusal, because when these parents fight, the children believe that if they are at home, they can rescue his mother. And father comes home and drunk, he will hit mother. So if he is at home, he can prevent a mother, rescue mother. So he doesn't go to school. Or even if you go to school, he will sit in the school, but all the time he'll be thinking about home. If my father comes home drunk, if he hits my mother, so they don't listen to the class. They become absent-minded in the class. See, when the child is growing up in the house, basic emotional support is required. Thus, basic security and basic trust is required, that is given by parents. How consistently parents interact with the child. The child is having fever, somebody is there with him. The child is having exams, somebody is supporting him. So child is having some problem. So one of the parent is with the child. So this neglect is taken care of. But in a family of alcoholic, generally the emotional needs are neglected, and there are possibility that physical and emotional abuse is very common, because when the parents are fighting, child cannot see, and most of the times what happens is even the smallest problems which are ignorable are highlighted, and the child is beaten up for small things like not scoring well or not keeping room clean. Some are other things. Frequently they are either physically or emotionally abused. And there are, seeing many alcoholic families, the studies have formed some roles in the family. Each one assumes a role in the family. So to summarize, addicts family, so there is a person, not that all children will behave the same. There is a child who, takes up all the responsibility in the house. We call him as a hero, because father is not working, he's all the time drinking, and mother is finding difficult to look after the house. So I'm giving example as if father is drinking and mother is not drinking. So it can be vice versa. Okay, there are families where mother is drinking, father is not drinking, or there are houses where both the parents are drinking. So the child starts assuming the role of parent and start working more, and he actually skips his childhood entertainment and doesn't mingle with his friends. He starts taking care of his younger siblings. So this child is hero, though looks good, but actually this child will lose his uh, a good childhood. So he will often become a workaholic, all the time work and look after the family. There is one more child, a scapegoat. Any smallest problem in the house actually is shown at him. The finger is shown at him. So because you didn't do well in studies, I got tensed and I started drinking. Because you didn't listen to me yesterday, so today this is the problem. Because of you, because of you. So for any other problem in the house, they scapegoat the child. There is a last child. This child is actually not demanding parents' affection, not reporting any complaints, not calling parents for any academic support and all. He is in his own world, lost child. So this helps these addicts. They are busy in their own world. The father is drinking, mother is having headache, mother is sitting idle, crying, and this child feels that they are in their own world. Who will help me? So he doesn't really bother them. There is a group of children who are very rebellious. They demand their rights and they quarrel with the father or mother. One more group of children is mascot or the clown. So in order to forget these pains in the house, they start making jokes, fun about everything. They think that they are trying to keep everyone cool, they trying to keep themselves happy, but actually they don't learn any responsibility. There is another group of people in the family, addicts family, enabler. It can be a child or it can be the spouse of the addict. So what they'll be doing is, they are actually, without their notice, without their knowledge, they will be enabling the addict. For example, helping him to recover from addiction, or today is not able to go for work, they are going in his place and helping him not to lose the job. Or he has taken debt somewhere, they will go and repay the debt. So indirectly they are supporting his addiction. So I told these. I'll skip these slides. Hero and uh, scapegoat. You understood. The last child. So all of us have to see these sort of roles assumed by these children. So in a group, in a schools, in a community setting, you see, you take history, the child who has grown up in the family of alcoholics, you see them to be very rigid, inflexible, very difficult in trusting or being closed off. For example, see, all of us develop how to be in a relationship. So we get the trust in an adult because we had good trust in our parents. So if the basic trust is affected with the child, with his parent, so he feels this is how an adult behaves. So they stop trusting all the adults. So they will have problems in the friendship. They'll have problems with all other adults. They'll have problems with colleagues. In fact, worst thing is they'll have problems with their spouses in the marital relationships. So shame and loneliness is always preoccupied. They feel ashamed of the father's drinking, or somebody talking about his father or mother, or teacher questioning about father, friends talking about his mother drinking. So these shame and loneliness trouble them often. Self-criticism, they always, with minute mistakes, they question themselves that I'm not good, my handwriting is not good, these scores are not enough, my, I'm not very confident, others are good. So he will try to put others friend, though he is qualified, though the child is good enough, but he feels that others are better off than him. So he'll be sort of people pleaser always. Like, you are a better person, you go, you take the responsibility, you become leader. So although they get opportunities to go on stage or go on exhibit their knowledge or skill, they will allow others to do, being highly sensitive or reactive. So there is all possibility that, see, a child living with alcoholic family, he grows up and goes to another family where people are, you know drinking just occasionally or only once in a while for parties or some cultural sanction. So still he'll become very sensitive to that, or he'll be very reactive to the situations, being overly responsible. So all the time they'll be thinking about addict, improving him, correcting him. So they feel overly responsible. What happens? They will not take care of themselves. They will not take care of themselves. So their priority is just think of addict, improving him, taking him to our treatment, or correcting the problems he has created. So they are prone to anxiety. So 7 C's, you see, very, very, very simple. See, thanks to Dr. Jerry Moy, who has designed this wonderful 7 C's. If you come across the children who are living with addicts, or you are treating an alcoholic in your ward, and if you get to children not get, you should tell them that you please bring children during weekends, say a Saturday afternoon when there is no class, or on Sunday during your rounds, call them and talk to those children and explain them that the problem in the house is because of addiction. So you didn't cause it. You are telling child that you didn't cause it. You cannot cure it because it has to be treated. It is a illness. You cannot control it. Many times children think that, if I do this, he will stop. If I be a good boy, he will stop it. If I throw all bottles, he will stop it. Or if I score good marks, my father will stop drinking. No, you cannot control it. You can help yourself, take care of yourself. So you have to tell the child that I can help myself, taking care of myself, communicating my feelings. All the out of shame and guilt, they don't talk. They don't talk about their problems. So we have to encourage them to talk about it. Many times talking relieves and making healthy choices. Earlier, what they used to do, get upset and go into drinking, get upset, go into smoking, get upset, get into bad company. Now, making healthy choices, joining some clubs, joining some voluntary activity, joining some drawing class, joining some theater activities, and then thereby celebrating themselves. So they should feel that they are worthy enough to live. Somebody is there to help them. Hey, I'll just give an example of a school teacher who, after interacting with us, understood that these children of alcoholics don't have a good family life in the childhood in the house. So after school hours, say for example 4 o'clock school hours gets over, and the parents are not there at home, When they reach home, they come very late, 6, 7 and all. So he started creating theater activities after school hours. So all the children who don't have a good environment in the house started joining drawing classes, theater activities, spoken English classes, music classes and all. And subsequently, we found that the children's academics are improved because somebody is there to appreciate that you talk well, you sing well, you draw well, you are a fantastic person. So a responsible adult in the life of a child of an alcoholic makes a lot of difference. So now we shift to other family members of addict, what they undergo. So the whole family lives in an emotional roller coaster of embarrassment. Again, same things: guilt, hurt, anger, and frustration. Many times, what happens? We will see. We will talk to these children of alcoholics. Actually, they say, how are you? Like he says that, sir, father comes home drunk and he screams, and mother, without drinking, also she screams. The father comes home and he doesn't spend time with me. And when I talk to mother, come and play with me, mother also shouts at me, go away, leave me alone. I'm having headache, I'm having backache, and you just be with your friends. So neither the father who is an addict is not available, nor the mother who is not addict also not available for the child. Why? They themselves are upset. They are in guilt, hurt, anger, frustration, becomes insecure as the addicts become less predictable. See, predictability of the behavior is very much important. Okay, anytime anybody can get anger, suddenly outbursts of anger, suddenly they beats up. So that unpredictability is very common in these alcoholic families. So all the family members, whether the father or parents of the addict or the spouse or the children, the whole family is suffering. They suffer from financial resources because everything that is earned will be spent on alcohol. So even the family members, they lose their luxuries, they lose their ornaments, they lose their facilities because there is no finances, there is no income. So because they have this poverty because of financial problems, so they isolate themselves because they compare with others how they are living, and they isolate themselves. So what they will do, the maladaptive behaviors, you should understand that even when you call the addicts family members, nobody turns up. They feel that, no sir, you admit him, you discharge him, I'll come only for discharges. They don't want to show anybody face that his child is admitted in the hospital or his spouse is admitted in the hospital, her husband is admitted in the hospital. They don't show outside. So they try to minimize the problem. When you are taking history, so he doesn't drink much. He only once in a while he drinks. ತುಂಬಾ ಏನು ಕುಡಿದಿಲ್ಲ, ಜಾಸ್ತಿ ಏನು ಕುಡಿಯಲ್ಲ, ಕುಡಿತಿದ್ರೆ ಮಾತ್ರ ಚೆನ್ನಾಗಿರ್ತಾರೆ, ಕುಡ್ದಾಗ ಮಾತ್ರ ತೊಂದರೆ ಮಾಡ್ತಾರೆ. So many times they try to minimize. They try to minimize that. Only at occasions he create problems. So we have to encourage them that don't minimize the problem. Tell it openly and share it. Attempts to eliminate the consequences. Many times the addict is having severe disruptive behaviors. Whole house is spoiled. But the moment somebody else is there, the addict's parents come in, the spouse clears up the house so that others who come visit the house should not know what's going on. So this way they are trying to hide things and they fail to take help. So they tries to control all measures and fails. Disorganized. The addict is already disorganized. Being with him and suffering emotional illness, they also become disorganized. Attempts to reorganize in spite of the problems, efforts to escape from the problem. What they do? They don't try to solve the problem. Say, actually, the problem is addiction. They have to take the treatment. The person who is addicted has to take the problem. So instead of that, they start finding escapism. Say, somebody to reduce their anxiety, they tend to be with their friends or join some other groups where suppose the addict is husband, the wife is all the time busy with her friends or some self-help groups or some other women groups, where being with that groups gives her happiness. So slowly what happens is she is not totally available for the family, not available for the children, not available for the husband. So in order to overcome this problem, they find escape roles. So it should not happen. We have to give them. So typical beliefs, what problems happen in the houses is don't talk, don't trust, don't feel. Because if you talk to alcoholic, do you drink? He says no. Or is your drinking causing problem? He says no, not at all. You talk to wife that are there any problems in the house? They say no, 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 no problems. We are fine. And the child is seeing there is problem in the house, but these people are not talking. So better is don't talk. The child also learns that not to talk about the family problem. So he become part of the family is to maintain secrets. Actually, if they talk, somebody will help. Somebody will take them for treatment, but they don't talk. They don't trust because the child believes that if anything happens to me, my parents has to support me. But when they themselves are not supporting each other, they are fighting with each other. So I cannot trust any adult. Don't feel. I will explain these slides. Okay, so don't talk. What happens in the home and in the family stays as a secret. Typically, it is parent has told, see, don't tell grandfather, don't tell grandmother about father's drinking because they will feel bad. Don't tell to other neighbor uncles because they will humiliate us. Don't tell to your friends. They will tell to teachers. So something like the parents has initiated, so the child learns. Don't trust, as I told you, when the parent himself, why lack of trust? They cannot rely on any adult because the first adult in their life is the parents. Don't trust self and own instincts to be correct. So once they're not trusting the parents, they don't trust themselves also. They feel that they are not trustable because they feel that others are good. Let others go ahead. Let him follow. Let him be people pleaser. Don't trust others, will follow through. Rarely will ask for help. Okay. Fear of authority, loss of control of authority figure, as authority figures are parents in the house. Don't feel. See, if I feel bad, if I'm feeling happy, if somebody comforts me when I'm sad, if somebody appreciates me when I something do good, so I feel like sharing my feelings. But what happens to these children? They feel that there is no point in having any feelings because everybody is concerned. Their focus is what's happening to the addict. Nobody bothers, what's happening to the child. So slowly, the child will feel that there is no point in sharing your feelings. So there is inherent acceptance and learned numbing of feelings because the child learns that situation will not change in order to cope. Their feelings must be stuffed. There is no point in expressing. So just keep it to yourself. So you don't tell. Learn to focus only on having feelings regarding others. So what they do is take care of father, take care of mother, take care of the younger siblings. So don't take care of yourself. So they feel that there is no point in feelings. If I show feelings, I'll become close to you. You will leave me anyway. So better, safer is I'll not become close. So they don't make friends. They don't maintain a good relationships. They have future marital problems. Why? They live in a circle. They don't allow other partners to enter into their inner circle. They feel that if I become close, everybody will behave like my parents. They will leave me and go. So better is I don't become close to anybody. So they have these trust issues. What a sad thing, na? Not to feel. So what we can teach them? We are teaching the 7 C's dictated by National Association for Children of Addiction. We are telling them that these are Sapta mantras. I didn't cause it. So another addiction is never my problem. I cannot control, I cannot cure it, but only I can help take care of myself by making better choices, communicating myself, and celebrating myself. So addiction, the family is being affected because um, yes, I'll skip few slides which I have already told. Enabling behavior, you understood enabling behaviors. They think that they are helping the addict. They are helping. Actually, they are spoiling him. It's a very destructive way of helping him. See, what happens is they justify the behavior. Like for example, he has fought with a colleague and came. He justifies that he irritated me, so I drank. My friend deceived me, so I drank. And the spouse believes that, and they feel that he is fine, but somebody has bothered. His boss is irritating, or his friend has deceived. So they're justifying his alcohol. Sometimes the addict comes and asks for money. Can you please pay me 5,000? I'll return it tomorrow. And the family member believe that, oh, genuine, he has to give somebody. So they sell their ornaments, keep debts, and again trying to help the addict. Actually, these things are helping him to continue in the addiction. So how you identify these family members need help? They live in constant shame and loneliness. You if you don't involve them, actually they have a lot of hurt, grief, anger, and guilt. So you allow these family members to talk. See, in our hospital, what we do is every 15 days we conduct family meetings. We call all family members, whether it is parents, for unmarried people, we call the spouses and parents. For the married people, we even call children. So first we give the information about how addiction is a disease. Second thing is how these codependent behaviors of family members interfere in the addiction process, and it interferes in the recovery. So only then they will understand. Otherwise, what happens? They fight, and they will be adding to the problem. So what are codependent behaviors? So he's become dependent on addiction. These people being with addict, they have developed certain problematic behaviors, which is called as addiction, codependency. So codependency trace, there is loss of structure. They are not disciplined. They are not taking personal care. Even if they are having health problems, they don't seek help for that. So they are almost living like a depressed life. There is no enthusiasm. There is no creativity. There is no happiness in them. Actually, there is no problem per se. Only they are thinking about the spouse addiction. They are like that. Actually, they can live, they can dress up well, they can meet friends, they can meet relatives, they can go out, they can do their regular activities. But because they are all the time thinking about the spouse addiction, or need not to be spouse, any person in the house about addict, they feel affected. So these codependency traits continues: inability to make decisions, inability to maintain interpersonal relationships. They become defensive when somebody talks about their family problems, inability to set and maintain limits. Because many times what happens, when there is problem in the house, they tend to if they tend to share with others, the others in the name of helping them, sometimes they start giving some advices which are not good to them. Why you are living with such an addict? You don't need to be with him. Let him suffer. You stay separately. You go to your mother's place. So many times they are not so good advisors. So they don't know how to set limits to others. To accept what these family members need to know, to accept the addiction is a serious problem. It requires professional help. Otherwise, they'll be telling like you promise on God, you take a oath, you will not drink, or you tell me why you are drinking, what I should do used to stop drinking. So they put a threats, or they make him think that it is just a lack of willpower to stop drinking. So actually, they should understand that it's not problem with themselves, it's problem with the disease addiction. So you don't think that you can do something about uh, drinking. To start communicating openly with the other family members. So you have some trusted families, you have your parent, you have your friends, or you have your doctor or counselor. So you share all your feelings with them, so you feel relieved. So you have to educate these family members. You go for recreational activities, you go for morning walks, you go for some bhajans, you involve in extracurricular activities, you give some time for your carrying out your hobbies. So only then they start feeling their self-esteem is back, and they don't blame the addict for all the time for their unhappiness. To accept as they are, not alone, and help is available. So now onwards, all departments of Agada Tantra probably is not only for the people who come with addiction. So we have to create more number of leaflets, more number of educative leaflets, or the videos in the outpatient department educating that if there is a alcoholic in the family, even family members need help. You too will have some mental health issues like anxiety, depression, adjustment problems. So if addict has to improve, the whole family has to recover. So you have to create some healthy leisure activities. So we have to teach them to involve in leisure time activities. Otherwise, they'll be just cursing the addict. Many times, at least he drinks for 3 days, another 3 days is fine. But all those 3 days, because of these codependent patterns, they fight. As I gave the example of a child telling that, sir, evening my father drinks and comes home and he fights. Morning my father doesn't drink. My mother, without drinking, she fights. So this is, they spoil their life by constantly thinking of the addict. So they can be encouraged to live their life without even bothering about addict. So slowly, family members being happy and comfortable, having a quality of life, helps addict to overcome it. Otherwise, they'll be they should understand that these things like hiding the bottles, throwing away alcohol and drugs, or all the family members arguing, trying to influence, we call panchayati, all calling all relatives and making the addict, making family members to scold him, like give advice to him like that. So punishing, threatening, lecturing doesn't give any useful results. Okay, there is a joke, an alcoholic going on the road. The police ask, "Where are you going?" He is telling that I'm going to listen to a lecture. Then police tells that, why at this 12 o'clock, who will give lecture? He says, no, my wife gives lecture now. So actually, giving a lecture when under the influence of alcohol, actually, he will not remember. So understand that how much ever you talk, how much ever you scold, he will not understand. So there is no point in giving lecture. Only thing is you keep quiet. When next day when he comes out of the influence, if possible, take him to treatment. So we should have a small therapeutic goals, attainable goals here and now. We have to tell family members that suddenly he has to stop alcohol from tomorrow. It may not be possible. Understand that one day at a time. Today, we expect that he doesn't drink. Tomorrow, again, one day at a time. Or I will keep myself like today, one day I'll go for morning walk. Today, I will try to not to provoke the spouse for his addiction. So one day at a time. So they need not question that, he was admitted in 1 month in the hospital. He came out and 15 days after discharge, again he drank. But 15 days he was abstinent. You enjoy that 15 days. So we have to have a short goals for these family members. They cannot think that, no, let him stop alcohol completely, then only I will live with him. That may not work. So goals of the family therapy to provide information about addiction and the family system, how it helps to help the family to understand inappropriate responses with their defects and characters. Many times they will not understand. If we try to tell that you need to help this, you need to be less provocative, you need not give lecture, so they become defensive. They feel that doctor is taking side of the addict. They are giving advice to me only. Why don't they treat him and make him free from addiction? They might become defensive. So take their faith, confidence in you, and then consider that we need your help to get your son better. We need your help to get your husband better. We need your cooperation to get your mother better. So many times the family members has to change their expressed emotions, their hatredness towards the addict, their cold behaviors towards the addict. That will improve. To improve interaction among the family members. See, they admit the alcoholic and from next day, nobody comes to see him. See, we have a patient with the fever, dengue, 10 family members will come to visit him. We have a person with asthma, 10 people are staying all the time with him. But you admit an alcoholic, no family members want to stay with him. Why this difference? So give this disease model, like it is also a disease of the mind, disease of the brain. So the psychiatric associations have proved that it is disease of the brain. So the person has lost control over drinking. So as a family and treating team, we need to help him. So slowly they will understand you. They will come to know that they need your cooperation, and they will start helping. So what you all can do, especially coming back to COA week, I started with initial slide. I'm talking only about my Ayurvedic friends from different colleges. Every year they support us to conduct this COA Awareness Week. Of course, not just in the February. Throughout the year, you people are doing wonderful work in your departments of Ayurveda, especially treating with the de-addiction. And every year, these departments from Shri B.M. Kankanwadi Ayurveda Mahavidyalaya, Belgaum, Dr. Suhas Kumar Shetty. So he has really taken up it very seriously, conducting awareness in bus stands, conducting awareness in orphanages, conducting awareness programs in hostels. Just think, if there is free hostel, if there is orphanage, if there is homes for children with destitutes, who are they? They are nothing but their parents are having addiction. Most of the time, either mental illness or addiction, they abandon the children. So we need to conduct programs to those children homes, orphan homes, or bus stand, these children, so that they develop some good behaviors. They develop leisure time management skills, coping skills, so they don't become addicts in future. So not only treatment, prevention is a big thing. So Sharada Ayurveda College and Hospital, so Dr. Sandeep and Dr. Sapna from that college have taken up seriously about conducting awareness programs in the community. So recently, this year, COI week, we conducted a program for volunteers of a village. Volunteers of a village who were mostly involved with cleaning and educating girl child and other things, vaccination drive like that. So they were given, the volunteers were given the option of being helpful in raising awareness about addiction prevention. They happily took it up. And in Belgaum, you see at least some 7-8 activities every year they conduct. They contact the local FM radios, and these FM radios are wonderful things because that reach at least 20-25 kilometers radius. So many thousands of people can listen about the information about these things. All the time, everyone will be focusing on the addict. Now people will start focusing on the children also. They will think that they have conducted radio skits and phone-in program also. People will ask queries, and Dr. Suhas Kumar Shetty will clear their doubts. So they have conducted this year these programs. Dr. Sunil Kumar, who is working with us, he is Ayurvedic physician, regularly goes to schools and colleges and give awareness programs on alcohol, smoking, ill effects of it. And this year also part of Children of Alcoholics Awareness Week, he has trained many nurses of nearby colleges. So this is a radio talk in phone-in programs. So here I stop, but the way forward is involve the family in your treatment. Any addict you are talking, keep in mind that you call your wife tomorrow, I want to talk to her. You call your parents, I want to talk to them. I want to take history from them. So you don't buy only one side. The person might tell you that, my wife is not treating well, they are neglecting me and all. You call family members. First, they will be defensive. You give a call to wife, she will tell that, who gave you my number? You don't call me. He is no one to me. I don't consider him my husband. So in the initial phase, they will not cooperate. Only when your tone of voice is heard by her as caring, that I am interested in helping you also. So please come and talk to me. Then they will involve in the treatment. So structured family meetings in your hospitals, when you call these addicts periodically for treatment, one common day, monthly once or 15-day once, you call their family members also. So give them information. We will help you to give a content, what has to be conveyed to them. We can work together. So there are groups, see, these Al-Anon groups, the wives of alcoholics. So we have Mrs. Sheila, who is working with us from many years. So she comes and trains these women whose spouses are into alcohol, or or sons are into alcoholism, how they have to help themselves, also the addict. All teen groups, the children of alcoholic, children and adolescents of these alcoholic parents. We have to give these information to these families. So involve self-help groups. See, many times you will be called to talk on various things like anemia, health prevention, or some vaccination drives. You will be called to talk to many people. These self-help groups, sometimes thousands of them will be in a group. So invariably, even if they are requested or not, you offer them that you have called us to talk about anemia, you have called us to talk about cervical cancer, but 15 minutes we'll talk about addiction also. Invariably, most of the families will suffer from alcoholism, and we want to talk about how alcohol affects women, how alcohol affects the family members. So even if the self-help group is there who are nothing to do with alcoholism, but some family member is affected by alcohol. So giving information how you have to help yourself goes a long way. So you all are good at writing sometimes. So involve in writing articles about addiction, how it affects the person, how mental health and physical health is both affected, how family is destroyed because of addiction. You can talk in public talks or TV talks, radio talks. So that's a small thing, little thing we can do as doctors to this community, because the you say cancer, there is help available. You say any other disease, people within no time help. Say you put a notice in the social media that there is a poor patient having dialysis every day. He needs some money. Family has to be supported. Children has to be supported, and immediately help will come in no time. But you put a social media request, I'm treating an alcoholic, and we need treatment for his treatment de-addiction, nobody will help. So these people with addiction needs our hands, helping hands, and we should give them message that you are not alone. Also the families of alcoholics, families of the addicts, we should tell them that don't worry, we are there with you. So I thank all the organizers and Dr. Shobha for coordinating this program. I hope the information given about the children and family members affected by um, addiction will be helpful in your future practice, and by and large, it will definitely help in making a better society. Thank you.
Thank you, sir, for that informative lecture. So the session is now open for discussion. So anyone having questions may please ask it.
It need not to be doubts. You can, you can share a similar kind of activities you've been doing, or any suggestions to us, what you are doing, any suggestion that we can adapt.
Any input, suggestions are please welcome.
Sir, I guess there are no such suggestions. This is really a new topic for all of us.
Yeah,
Nobody has thought on this lines, as you
yeah,
said rightly. Dr. Ajit, I think I can take over if that is fine
yes,
with your
yes,
Yes, ma'am. Yes,
permission.
ma'am. Please,
Thank you.
please, I
Thank
request you
you.
to deliver the vote of thanks, ma'am.
Thank you, Dr. Rajit. Sir, I'm indeed very thankful to you. This was a very informative talk for us, a new insight in the treatment of addiction. We usually concentrate because this is a new topic that Agat Tantra has taken up recently. And we have no much centers, people from toxicology, they are not much involved into the treatment aspects. And recently, this has been included in the schedule. So all of us have been thinking in this grounds, along with the physicians of Manasaroga. So this insight that we need to consider the families also,
yes,
arrange for a talk with family, and arrange for their meet also. We knew about the Bandari sir also had said us regarding the various initiatives we need to take for the alcohol addicts, the AA programs. But then the family also must be given due importance. They are also a part of the complete treatment. Now this concept is really new for us. So next time we meet you, maybe we'll be sharing our views. Now we have to initiate this view, and for that new insight, I'm extremely thankful to you, sir. I understand you are such a busy personality. You are always busy with your OPDs and your talks, but then with our request, you have taken out this valuable time, and I am extremely sorry for the inconvenience. We couldn't help you out much with the slides. Anyway, it was well managed as well. It was very clear, and we are on behalf of the organizers, sir, I and the Agartantra Vishwa Parishad Agartantra Sambhasha, I take this opportunity, sir, to wholeheartedly thank you. And this is just the beginning. We have just started with you, and we'll be disturbing you at least once in a year, hopefully, to get your insights. Thank you so much.
I'll be happy to help all of those who are watching this program. If anybody wants to work particularly with children of alcoholics and families of alcoholics, if they need any additional information, they can contact me anytime. Okay, thank you.
Surely, sir. Thank you so much, sir. I thank all the audience for their patience listening. Thank you, sir. Thank you, one and all. Thank you, Dr. Ajit. Thank you.
Thank you, ma'am. Welcome.
Mhm.